Pillow face basically is your face is so filled up with filler that it looks like a pillow. That just is too plump and fluffy and is not facial like anymore. This is Medspa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Today, we cover a lot of ground, from pillow face and ducky lips to cool sculpting and barnacles. If you're into wacky vocabulary, we've got you covered. Stay tuned for part 2 of Medspa Terminology 101. Hi, this is Dr. Kate Dee, and I am back with Dr. Desiree Otto. Thanks so much for coming back to finish off our Terminology 101, part 2.
Thanks for having me. Glad to be back.
Yeah, so on the last episode, we talked about lots of different terminology that related to Botox and other toxins and Botox treatment and wrinkles. And I was hoping this time we can expand into some of the terms related to the skin and skincare, some terms related to filler, and then a few other specific terms that are related to some of the treatments we do, because there are just so many questions about these things. So I would love to start with filler. First of all, can you define what a dermal filler is? A lot of people are confused between what the difference is between Botox and filler. Do you have a really good way of explaining the difference between Botox and filler and what filler is?
Sure. Well, Botox is a toxin like we discussed, and it paralyzes the muscle that it is injected into. So it's not, it just goes in, has its effect, and it goes away. Filler is a gel that's injected into the face or body, and the gel replaces lost volume, so it's adding volume. Where toxin is paralyzing muscles, filler is adding volume. And I think about the filler like hair gel. There's the extra stiff stuff that if you squirt it out, it makes a big tall mound. There's the liquidy stuff that runs and pours off the table if you squirt it out. And some of it's gooey and stretchy. And that's really what filler that looks exactly the same as hair gel when you squirt it out.
That's a really good, I've never heard you say that comparison, but that's a really good one. There are definitely different consistencies and flexibility of filler. And so basically dermal filler is, all the ones we use are made out of hyaluronic acid, which is a natural substance. It's in your body. It's in all your joints. And you can put it in skin lines, in lines in the skin. You can put it into areas of the face that need more volume, that you've lost volume. It helps replace volume that's lost. So I have a few terms here related to filler gone bad. So first of all, what are duck lips or ducky lips?
It kind of, just as it sounds, lips that kind of start to look like a duck bill, meaning often that happens where there's just too much filler in the lip, the red part of the lip, but also too much filler has migrated into the white part of the lip as well, so that whole lip area sort of sticks out in an unnatural looking way, and also just sort of full all the way across versus having a natural shape.
Exactly. And part of the definition, I wanted to add to the definition of the vermilion border, because we use that word a lot when we refer to lips. So the pink part of your lip is the vermilion, right? And the vermilion border is where the pink part meets the edge of the actual skin. And so many injectors will inject them vermilion border. I don't like that because I think it makes it look way too prominent. Unless you have somebody with zero lip, I think it looks really weird. But anyway, it's very popular to do. And if you put too much in, you end up looking very ducky. And so that's what duck lips are. Have you heard the term pillow face? I just had a patient use that today. Pillow, have you heard it? Pillow face basically is your face is so filled up with filler that it looks like a pillow. It just is too plump and fluffy and is not facial like anymore. Sometimes people will use the term chipmunk cheeks. I had a patient a few years ago who went elsewhere, young, beautiful girl. She went someplace and they put 4 syringes of filler in her cheeks. And she said, "Oh my God, I have chipmunk cheeks." But essentially it's just too much filler.
Right.
I think HA is a good one. So you mentioned hyaluronic acid fillers before. So hyaluronic acid, a lot of people don't want to say that because it's, too many syllables, but you can just say HA instead. And hyaluronic acid is in a lot of skincare, actually. It plumps the epidermis and makes your skin a little plumper, and that feels really good. But that is the ingredient that's in most fillers. In our practice, we do not use any other kind of filler. There are some that are permanent fillers that are more dangerous, and we don't use them. HA fillers, that's the way to go.
I just, hyaluronidase or Hylenex might be something.
Oh, yeah. So, and then Hylenex is a enzyme that breaks up hyaluronic acid. And so Hylenex, we always have in the fridge, and we have it for emergencies. So God forbid you didn't like it or you had some complication, we could dissolve the filler with Hylenex. And that also is why we don't use the permanent fillers, because you can't dissolve them. And so if you did have a problem, you could not treat it. Since we're there, the next terminology I have on my list here is vascular occlusion. Also, sometimes you just call it occlusion or a VO. So what's a VO?
Well, vascular occlusion is, again, just sort of what it sounds like. It's when a blood vessel, which carries oxygen to your tissues, gets occluded or blocked. And in aesthetics, this typically rarely can happen when you're injecting filler, which is a gel.
Right. So if you block the blood flow of an artery, then whatever tissue of your body is fed by that artery won't get enough blood flow, and that tissue could die. And so you can get tissue necrosis, and necrosis means death of the cells or death of the tissue in that area. And so that's kind of like our most dreaded complication in any medical spa. And it's something that everybody should know exists, and everybody should be very anal about and make sure that you know how to treat, God forbid it were to happen. What about migration? What does that refer to?
Migration refers to filler, and filler moving from where you originally placed it. So placing it in one part of the face and it moving to another part of the face, which is it's a rare thing, but it can happen in certain areas like the lips, like I just mentioned. If you try to put too much filler into the red part of the lip and there's just nowhere for the filler to go, there's no space, then the filler can migrate up into the white part of the lip, just because it's sort of reaching a dead end, like it just can't stretch anymore.
Yeah, I would say the migration that I've seen has been mostly in lips. And that is why sometimes that thick part, the flesh-colored skin above the pink part of your lip, that can get extra thick because the filler migrates up into there, and that really looks really bad. So I haven't really seen very much migration elsewhere.
I guess the one area that I have seen it is the tear trough area, and sometimes it can happen. It can be there years after the treatments, and that's part of the reason that we don't do a lot of tear trough filler treatments.
Yeah, we've moved away from doing tear trough filler as well. We really prefer PRFM for that, which I did talk about in another podcast if you guys want to go back to the podcast about PRP and PRFM. But meanwhile, yeah, one of the issues with migration and the tear trough is really it can get, I don't know if it's placed there. It could be placed there in the first place, just too deep. There's kind of a septum between the front of your eyeball and the back of your eyeball. If it gets deep to the septum, then it's not going anywhere. And there are actual MRI studies showing that the filler is back there like 12 years later. So I don't think it could migrate past the septum on its own without being placed there. But we've definitely seen persistent tear trough filler that nobody wants over a long period of time. The next set of terms have to do with products. And I really wanted to point out the difference between growth factors and exosomes and what kind of growth factors are out there. So a lot of skincare products say that it has growth factors or stem cells in it. And these are really different things. For the most part, growth factors are human growth factors that are either derived from humans, like in PRP, where you're actually getting a blood draw and you're taking your own growth factors out of your blood. Or there is human growth factors that are included in retail products that you can buy. For example, Skin Medica has a TNS series that has human growth factors in it. Those are really different from plant-derived growth factors, which really don't have an effect on human cells. It kind of bugs me because a lot of products advertise that they have plant growth factors or plant stem cells. And just keep in mind, there's no data that a plant-derived growth factor has any effect on human skin. A lot of these are designed to try to stimulate collagen inside your skin, which is another term I wanted to define. But just keep in mind that it's really human growth factors that can affect your skin. So you have cells inside your skin that make collagen. Collagen and elastin, those are two proteins inside your skin that make your skin thick and springy. So we care about that because as we get older, we lose our collagen. And your cells in there that make it, they go dormant. They don't make more. And then your body breaks those things down, usually about 1% to 2% per year. So your skin is slowly thinning as you get older. So we talk a lot about collagen. We talk about elastin too, but sometimes we just say collagen and it kind of stands in for both. But we focus a lot talking to patients, talking about making sure those cells are awake, making collagen for you so you don't continually lose the thickness of your skin. So those are what growth factors are. Exosomes are what we used to think growth factors are. So with cells in your body, they communicate. And one cell can communicate with another cell by sending out a little growth factor or a little communication molecule that says, hey, do this or do that. Okay. It turns out that back when I was in medical school, which is so long ago in the 90s, we thought that those growth factors were secreted and it communicated with the other cells. But in fact, cells don't really secrete naked growth factors. They secrete exosomes. And the exosomes are little packets. They're like little tiny membrane-bound packets of information, different growth factors and peptides and signals inside the exosome that is emitted from one cell, goes to another cell, and gives that other cell a signal. We used to think that we didn't even know about exosomes, but I think exosomes were discovered around 20 years ago-ish, and they've been studied. And so now one of the latest trends in aesthetics is to use exosomes the same way we've used growth factors in the past to try to stimulate collagen and have healing in the skin and below the skin. So there are a lot of products that use exosomes, and in my practice, we've added one product is called Plated that has exosomes in it. I've done kind of my own personal deep dive, so that's the one I think is the best one. But it doesn't matter. It's just important to keep in mind that exosomes are very cool. They're really interesting, But you want to make sure that the exosomes are really high quality because they're derived from cells, and that they're sending the right signal. Because if the exosome's being sent out from cell to cell and it's sending a signal like do this, do that, you want to make sure that the signal is a positive healing signal, build collagen, promote healing, and not like a negative or a mixed bag signal of like do something destructive or do something inflammatory, which
inflammation,
cause inflammation. So it's a really interesting topic, and I'm sure I'm going to try to do a whole podcast about exosomes. It'd be really interesting. But that's what they are, and they're basically just signals that we're trying to harness to make our skin kind of maintain itself and heal. So we talked about collagen and elastin. One term, I don't know if you have a definition of anti-aging. I kind of do in my head, but people use the term anti-aging to refer to just about everything that has ever been done to the skin. But what do you think anti-aging means?
Well, I think it's anything that you're doing to try and prevent aging, or to, really to prevent aging. And it can range from, in aesthetics, I guess, skincare and skincare treatments, and using sunscreen as anti-aging. It's preventing the aging, and the UV rays that hit your skin are damaging, so you're preventing aging.
Yeah. I agree. I think anything that's preventive. I think that things that make you look nice but don't prevent anything or slow anything down, I wouldn't call those anti-aging. So for instance, a hyaluronic acid serum, makes you look nice, it plumps the epidermis, but it doesn't do anything to prevent or slow down aging. Whereas like a vitamin C that promotes collagen synthesis inside the skin, I would count that as anti-aging because it's actually doing something to prevent loss or prevent the signs of aging. Two more terms that are related to products: retinol versus tretinoin. Do you want to define those?
Sure. Retinol, tretinoin, and there's a number of other varieties. They're all vitamin A derivatives that can be applied. We typically use them as applied topically, and they increase the turnover of the cells at the very surface of your skin. And there's a lot of clinical research on these that have shown that using tretinoin or retinol products can reduce this fine lines and wrinkles, and also those products also help with acne as well. So because the turnover at the surface unclogs pores, because if the turnover is slow, then you have congested pores and dead skin there. But if the turnover is faster and you're sloughing more of the dead skin on the surface, then you have less clogged pores.
Yeah, and the difference between tretinoin and retinols is that tretinoin is a prescription medication. You can't just buy that over the counter in the United States. Whereas retinols come in various forms, and those are in over-the-counter products. There's a huge variation in those, the over-the-counter ones. I personally like Skin Medica because they are a company that has actually done laboratory studies showing that the amount of retinol in their product is actually the amount that's on the label, and that they've shown that it's as effective as prescription tretinoin. So I like those. Retinols can be very much all over the map. So if you buy a retinol cream, it could have very, very, very little retinol in it. But whereas tretinoin is going to be whatever the percentage is that you get from the pharmacy.
Right.
And if you really want cheap tretinoin, you can get some in Mexico for way less money than in the United States. There's one more term I wanted to mention is the term comedogenic or non-comedogenic. So that is kind of a non-medical term, actually, that I'm not sure was maybe made up by the skincare industry, but comedogenic means it causes acne, and non-comedogenic means it does not cause acne. And the one thing I can tell you is if you're buying over-the-counter products from any place, whether it's Rite Aid or Walgreens or Sephora, there is no relationship between the word non-comedogenic and whether it's going to cause acne in you. So there are just so many ingredients in all of these products that are acne related, acne causing. That's a whole other consult that I really like to do and talk to patients about. But it is kind of a marketing term, and I don't think that it has any actual correlation or validity with any actual medicine or science. All right, so there are a whole bunch of terms I wanted to cover relating to procedures. So first of all, one of my staff mentioned laughing gas. So we just got laughing gas in our clinic. Do you want to define laughing gas?
Well, laughing gas is, I think most people are familiar with laughing gas from the dental office, and it's nitrous oxide, which is a gas that you breathe in, and it helps you deal with anxiety and discomfort, and it's very short acting. And so you can have the laughing gas while you're having the treatment, and then it's gone, and you can drive home.
Yeah, and it's basically nitrous oxide. So, yeah, and in a lot of aesthetic places, they have a self-administered version of that where you can breathe into it, and it kind of gets you high and not notice that we're doing stuff to your face. How about microneedling versus RF microneedling?
Sure. Well, microneedling and RF microneedling are super popular treatments in our spa, and because they're great for all skin types. And microneedling is basically stamping the skin with little tiny needles. And why would you do that? You do that to stimulate new collagen and elastin. Microneedling versus RF microneedling. The regular microneedling just uses little tiny sterile needles, but radiofrequency microneedling or RF microneedling, at the tips of the needles, there's a little zap of energy at the tips of the needles that creates a little bit more injury, and it can actually stimulate a whole bunch more collagen and elastin, and so it can actually tighten the skin.
Yeah, it's many orders of magnitude stronger than regular microneedling. Regular microneedling requires, multiple channels being created into the dermis, and then the use of a growth factor serum or exosomes to go in through the channels and turn on the cells to make collagen and elastin. Whereas RF microneedling, you're basically sending a whole bunch of RF energy into the dermis, forcing the dermis to make a ton of new collagen and elastin. So you're basically remodeling the dermis in a major way compared to just nudging it with microneedling. So I think those are really big differences. People have very little understanding of that. It seems a lot of people who've had one think they've had the other. Similar to that, there's ablative versus non-ablative laser treatments. And I mean, just explain that. I mean, basically, there are many, many different kinds of lasers. And there are some lasers that are designed, remove hair. Some lasers that are designed to treat red things. Some lasers that are designed to treat brown things. And then there's other lasers that are designed to resurface your skin. And the resurfacing kind, there's two brands of that. One is ablative and one is non-ablative. Ablative lasers vaporize the skin. So this would include CO2 lasers and erbium, basically in a controlled fashion, vaporize little fractional parts of the skin. And there's quite a lot of downtime from that because you're vaporizing little bits of your skin. Usually that's up to 2 weeks of, redness. Your face is sort of off and you got to regrow your skin. Non-ablative laser is when the laser is doing something similar, but it's just doing damage, not vaporizing the skin. And it's doing just enough damage to make the skin spit out those little bits that are getting damaged. And those little bits get spit out over about 5 to 7 days. And so it's way better tolerated. There's less downtime. And usually about a day of redness for a non-ablative laser resurfacing. The non-ablative laser, however, usually it takes several treatments to accomplish what you accomplish in 1 or 2 treatments with a aggressive ablative laser. But the total downtime is actually way less, even with 3 treatments. And it's way better tolerated and it has a way lower risk profile. So those are very, very different things. I've met people who didn't even know non-ablative laser resurfacing was possible. I'm like, well, yeah. So an example of the non-ablative laser is a thulium laser, and that's the kind that we both have in our office.
Yeah.
What about IPL and BBL? What are those?
IPL is intense pulse light, and BBL is broadband light. They're really similar technology, and so rather than the light being focused like a laser beam, it's a little bit a broader light. And
yeah, well, lasers are one wavelength, and IPL and BBL are both a band of wavelengths. And they're basically the same technology. BBL is just one brand of IPL.
And then you can use different wavelengths to treat different things.
And it's really just different filters. So you're starting out with visible light and you're filtering that light down to different bandwidths. And they are used to treat red things and brown things primarily.
Right.
So redness, dilated blood vessels, little red blotches, sunspots, stuff like that. I have on here next cool sculpting versus other body sculpting technologies like mSculpt Neo.
Sure. The mSculpt Neo is a super cool device, and it's really the first of its kind, and it's a device that we use to sculpt the body, and it actually does. It's two treatments in one. It's a treatment that actually builds muscle, so it increases the muscle cells and the size of the muscle, and it also kills fat. And so one of the areas that it treats multiple areas, but one of the areas that we treat often is the abdomen. And what it does is it stimulates the muscles to contract, and it also heats up the fat. And the heating up of the fat causes the fat to die, and the contractions of the muscles causes the muscles to get stronger and bigger. And the combination of the two is actually amplifies the result, amplifies the effect of the other. So when you heat up the muscles when they're contracting, you actually get more muscle growth.
Yeah, so mSculpt Neo builds muscle and kills fat using heat and muscle stimulation. Cool sculpting is very different. Cool sculpting freezes fat with the goal of killing fat. And it can do that quite well, especially if you have the right patient population. The fat has to be sucked into a cup and it's frozen for a while. And the fat sort of has to be the right shape, because if there's adjacent fat, it doesn't get treated. Any fat that's not in the frozen cup does not get affected one way or the other. So it can lead to some, irregular results. I think the drawback with cool sculpting, besides not touching your muscle, it really doesn't affect the skin at all. Whereas mSculpt Neo will actually tighten the skin just a tiny bit because it's using heat. But in both our practices, we have mSculpt Neo. We haven't ever used cool sculpting. Cool sculpting's gone a little bit out of favor anyway, since some major lawsuits happened with that. But really, body sculpting overall is waning because of the use of Ozempic and Ozempic-like drugs. But we'll have to do a whole other episode on that. Another question that I get is, what is a hydrofacial and how is that different from some of its competitors? I found out this weekend at this big aesthetics meeting I went to that after Botox, hydrofacial is the number 2 search word in aesthetics. So you want to just tell people what hydrofacial is, and I'll explain what the other ones are.
Sure. Hydrofacial is a facial using a hydrofacial device, and it's a very special device that uses this vortex wand that gently uses suction to kind of opens up your pores, and at the same time infuses product. And through doing various steps, it can extract all the impurities. It can infuse various treatments. There's various different boosters and things that we use with this treatment, and they can be used for redness or pigmentation or dry skin or acne-prone skin. So there's all these various serums that can be used with the hydrofacial, and it's very, very popular.
Yeah, it's been really popular in my spa as well. I tell people it's kind of like a wet back for your skin, which is really what it is. It infuses various serums and cleansers and stuff, and then sucks it out. And then you, even if you have the cleanest skin in the world, the crazy thing is it collects all the fluids after into this gunk jar, and you can see all the stuff that got extracted out of your pores. It's really pretty gross, actually. Hydrofacial is really well known. People ask for it. It's become kind of like Botox in the facial world. There are several competitors to hydrofacial that do something similar. They're a little different. They're all a little different, but they're very, very similar. So the couple are Diamond Glow, which is owned by Allergan. There's Derma Sweep. There's a whole bunch of them. And people are constantly trying to, create this sort of something similar and have some different take on it. But I really do like the hydrofacial, and it can be catered to different skin types and actually be used as a medical treatment too. So that's kind of cool. One thing I wanted to cover is what is medical grade skincare, because we've talked a little bit about that. And the term medical grade really is a made up word. There's no scientific or medical definition of that. Although I do use the term because I think there's a huge difference between a lot of the products that we use and what you can just get at a pharmacy or at Sephora. And there are a number of companies that make really high quality medical grade skincare. And when I say medical grade, I'm saying that, they have scientists who develop the formulations. They do actual scientific studies to show that the ingredients do what they say it's going to do. They test everything to make sure there's no untoward consequences. So, for example, one of the products that we use is made by a company called Sente, and they hired a scientist who developed this molecule that goes into the skin and plumps the skin. And it's, really it makes your skin all soft and supple. But when they were doing all the laboratory studies to evaluate it, they also found that it stimulated collagen and elastin, which is like this huge benefit from it. And then they also found that it helped a little bit with pigment, but it helped a lot with redness. And then, after a bunch more studies, a couple years later, they did a bunch more studies and actually got their product certified by the Rosacea Society to treat rosacea because it was so good at treating redness. So those studies are actually being done. And that is really not true for most skincare. You go to fancy skincare place and buy whatever. There's no laboratory study saying it does anything. So in my mind, the big difference is that a medical grade skincare actually has scientific studies proving that it does stuff. I just have a couple more terms, so we're almost done here. And that is, I just want to cover what does it mean to be FDA approved versus FDA cleared, and then also what it means to be off-labeled. Do you know the difference? This is a really good question. Do you know the difference between FDA approved and FDA cleared? Probably not. I think most doctors don't actually.
Not.
Yeah. Well, I'll just say, so the FDA governs most of what we do in medicine. And in order to be used as a medical device, you have to get FDA approval, meaning you develop the device, you do lots of scientific studies showing that it does what it's supposed to do and that it's safe. And that's very, very costly, and it's a very complicated process to go through. But once you have that device FDA approved, then someone else can come along and make a similar device that does the same thing, but maybe in a different way, or maybe with, a different feature or whatever. And all they have to do is prove that it is substantially similar to the first device that went through the big process. It's a quicker process. You don't have to do nearly as much in the way of research or studies, and it's much, much cheaper. And that is what's called FDA cleared. And so a lot of devices, we think that they're like brand new and they went through this thing like, oh my God, that's so amazing. When in fact, they just got FDA cleared and not approved. And all they're doing is proving that their device is substantially similar to another one that's already FDA approved. And the reason this matters to consumers is that a lot of times people are selling something that is like brand new innovation, amazing new technology. And really it's been around for like 25 years. They're just rebranding it. And then the other thing I wanted to just mention is what it means to be off label. And that is every time something is FDA approved, it comes with a label where the FDA says, okay, we're going to approve this device or this procedure as long as you do it this way. And it's all on the label. And you can only do those things. So for instance, Botox is FDA approved to treat all three areas: glabella, forehead, and crow's feet. Whereas I think all the other ones are only approved for one or two and not for all three. But as a physician, we can use anything we want off label. And so we say, oh yeah, I'm going to take this Botox and I'm going to treat your masseters for teeth grinding. We can do that. That's legal. There's nothing illegal about that, but it's off label because it's not been approved for that purpose, right? So that's what off label means. Now, doctors are allowed to treat off label, and there are a lot of laws about who can treat off label. There are a few more things that we need to cover. So why don't we go through there? What's a cherry?
A cherry is a little red vascular spot that a lot of people get as we age. Some people are really prone to them and can have these like little red spots all over their body. They actually happen during pregnancy, so sometimes they're related to having a little bit more estrogen. So women tend to have more of them, but I see them in lots of men as well. A lot of redheads tend to have a lot of them.
I think we all get them. So yeah, those are actually really easy to treat, little cherry angiomas or cherries. We can also treat spider veins. So spider veins are little dilated blood vessels under the skin. When you have little dilated vessels in the face, those are pretty easy to treat. When you have them in the legs, they're a little harder to treat. We don't actually treat legs in our spa. Do you treat legs in your place? No, yeah. It pretty much takes a different approach with to be able to coagulate those. What about sunspots or sun lentigos?
So sunspots are little brown colored spots that we develop with age. A lot of times in areas where the sun hits us, so a lot of us will get them on our cheeks and foreheads and shoulders and arms and anywhere.
Yeah, you can basically get them anywhere. We see them on the hands a lot too. People will often treat their face, neck, décolleté, and hands for sunspots. Not that you can't get them elsewhere. And then peach fuzz. That's just peach fuzz is just the little fine little hairs on the face. Some people have kind of a lot of peach fuzz, and other people have much less.
Right.
And that comes up because we do a thing called dermaplaning that actually exfoliates the skin, but also happens to get rid of all the peach fuzz. People really like that.
Right, exactly.
And then I have one more on my list, barnacles. Have you ever had people refer to barnacles?
Yes. And a lot of people come in and think that the barnacles, which are seborrheic keratoses, which are these kind of waxy brown spots that can be raised that develop with age, and they kind of can look like barnacles.
They kind of do.
You get a lot of big ones that are raised.
Yeah, we don't actually even have a good treatment for seborrheic keratosis in our spa. These are pigmented lesions, and we tend to not treat them to make sure that they go see a dermatologist to get those sampled. Well, I think that is all the time that we have for today, but I think that's a pretty exhaustive list. If anyone at home has a term that they have no idea what it refers to, please reach out and I will absolutely mention it on a future episode and I will get back to you right away. I appreciate everybody's feedback over time. And Des, thanks so much for being here today.
Thanks for having me.
If you have a question or a crazy story of your own that you'd like to hear on Medspa Mayhem, contact us through our website, medspamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Medspa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspamayhem.com. I hope this has been helpful in understanding the quirky vocabulary of the aesthetic world and that you've learned at least one new term you didn't know before. For now, grab some non-comedogenic medical-grade exosomes and have an FDA-approved laser treatment with laughing gas, and we'll see you again next week with more Medspa Mayhem. This has been Medspa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Medspa Mayhem comes out June 2024. Available everywhere books are sold. You can pre-order now on Amazon, Barnes & Noble, and at bookshop.org. Links and more can be found on medspamayhem.com.